In this lecture, we will talk about personality testing. Personality testing is one of the more interesting assessment opportunities you will have as a counselor. In addition, it's also going to be one of the most challenging. Before we begin, let's talk a little bit about personality. We've all heard the term personality, and it's used quite frequently in everyday life. We talk about an individual's personality, whether they have a good personality or a bad personality, and it usually relates to how well we could get along or interact with that person. Psychologically speaking, personality goes much further than our ability to interact pleasantly or not with an individual. As we look to define personality, it's important to realize that there is not a consensus definition of what personality means. Over the years, several researchers and scholars have come up with different definitions of what exactly they believe personality to be. None of these have caught on with universal appeal. Should we try to come up with one that approximates what it is we as counselors are looking for, I offer the definition given by Piedmont, which also appears in your textbook. According to Ralph Piedmont, personality is an intrinsic, adaptive organizational structure that is consistent across situations and stable over time. Now, what does that mean? Well, if you look, there are certain elements of this definition that I have highlighted, and let's talk about those for a moment. First, we look at personality as being intrinsic. This means that it stems from within the individual. It is a part of who you are. Your personality acts upon the environment and not the other way around. It's an adaptive organizational structure. Our personality allows us to take in information from the world, synthesize it, and understand and assign meaning to it. Our understanding or perception of the world is filtered by our personality. Who we are determines how we perceive the world. This organizational structure is consistent across situations and stable over time. By and large, our personalities do not change. Of course, there may be examples when our personality is more or less on display than others, but roughly it's the same. An individual may be an introverted or extroverted individual, and certain situations may bring out the opposite. An introverted person may be very outgoing with a small group of close friends, whereas an extroverted person may become reserved and introspective when they have an important assignment or task to complete. But on the whole, they remain very consistent. More often than not, their true personality comes through. Another way we could look at personality and how it appears is by looking at the personality pyramid. If we start at the bottom of the pyramid, we see our psychological core. Moving up the pyramid, we see typical responses, role-related behavior, and on the outside we see social or environmental influences. These social and environmental influences act on our personality, interact with our personality. Our perception of the environment is then determined by our personality. Let's look at these components of the pyramid in a little more detail. At the bottom is the psychological core. These are the elements of our personality that are most deeply rooted. Here we have our basic attitudes, values, interests, motives, and self-worth. This is who we really are. When we strip away all facades, roles that we play, this is who we are. When we're able to be who we are, unencumbered by what others may think or say, this is who we are. Examples of elements that fall at the psychological core level would be your religious values and beliefs. Whatever it is that you believe, this forms the core of who you are. Above that are your typical responses. These are how you usually adjust to the demands of your environment. For example, how do you handle stress? Do you rise to the challenge? Or does stress cause you to retreat and result in you being unable to perform? This is how we typically are. If someone were to describe you, the characteristics included in their description of you would be our typical responses. Examples here include individuals who are happy, cheerful, and upbeat. At the top of the pyramid is our role-related behaviors. These are situational in nature. Our behavior, our personality, can vary slightly depending on the situation. How we determine what needs to change in a given situation is usually gained through modeling or social learning. In other words, we observe other people, how they act in certain situations, and we model our presentation after theirs. Examples here include our behavior as a student, employee, parent, child, or friend. We pick up cues from those around us on how we should act. In school, teachers establish rules for the classroom. Students know the rules, but they also observe the behavior of their peers to determine what they can and cannot get away with, what will be tolerated, and what will not be tolerated. These are examples of role-related behaviors. Now, if you look back at the pyramid, you'll notice that at the top, on the outside of the pyramid, the words external and dynamic. This part of your personality is fluid and changes. And these changes are very much influenced by the outside world. At the bottom, your core, these are the beliefs that are internal and consistent. They're a part of you, and it's highly unlikely that they will ever change. So knowing this about personality, how does it factor into the counseling process? Why assess personality? Knowing about a client's personality helps us to better understand clients' attitudes, behaviors, characteristics, their needs, and their motivations. You should see that without assessing personality to some degree, we really struggle in performing some of the basic counseling activities, such as screening, diagnosis, treatment planning, and evaluation. We need to know who our clients are, what their strengths are, what it is that they need, and what will motivate them. What can we do or offer to help them change and meet their needs? To assess personality, we have a couple of different approaches. There are structured and unstructured approaches. The structured approaches look at traits, expressions of personality that an individual has. They're more external. Unstructured approaches take a more projective view. They're looking for the internal, the unseen elements of an individual's personality. The remainder of this lecture will focus on the structured approaches, and unstructured approaches will be the topic of our next lecture. So what are traits? A trait is an enduring, statistically derived dimension used to explain personality characteristics. How do we describe an individual? So we may have an individual that we describe as an upbeat person, a cheery person, a pessimistic person. These are traits. They're made up of a collection of attitudes and behaviors exhibited by a client. An upbeat, cheerful person may have a smile on their face, may be warm and inviting to others. This idea of traits was pioneered in the early science of phrenology. Phrenology was a study that looked at the brain and the human skull. In particular, it was believed that the shape of your skull was indicative of your personality. Certain shape features were associated with different personality types. In general, traits are stable. They do not change. upbeat person, for the most part, is going to be upbeat. Sure, they may have days or periods where things are blue and they feel sad, but if we were looking at the collective, more often than not, they would present as being upbeat and cheerful. These traits are individual in nature. Everyone has their own personality traits. Even two individuals that we would consider cheerful and upbeat may present differently. Their manifestation of that cheerfulness comes out in different ways. We could take a collection of traits that an individual has and group them together. This grouping is referred to as a social profile or a type. And so we use this word type a lot when talking about friendships or romantic interests. We talk about a type of person that we like. And when we describe our type, we talk about different traits. Someone who is smart, funny, easy to talk to, good personality. These are all traits. Combined, it's a type of person that we're looking at. Opposite of a trait is a state. States are much more fluid and changeable. They represent transitory expressions of a personality trait. They're temporary. You might be a very confident and self-assured individual, but were you asked to walk a tightrope for the first time, your confidence may waver and you become more timid, scared. This does not mean that your total personality changed. It simply means that you changed in that specific example. Taken out of that environment or that context, you likely would revert back to your traditional trait personality. Because states are temporary, it's believed that they're a direct response to the environment. Had the confident individual not been placed on a tightrope, and validity of observations. How reliable are observations? Will clients act the same way every time? Will their behavior change when they know they're being observed? And then how valid are the observations we make? If we're observing a child for disruptive behavior in the classroom, what is disruptive behavior? Each one of us who observes the child may have a different definition or threshold for what disruptive behavior actually is. So we could be observing the same child but come up with completely different results of our observation. Interviewing is a way to get at some of that internal information. We engage in a verbal exchange with clients, whereby we request information and clients share with us. Interviews can be used for diagnostic purposes, where we're trying to determine whether or not an individual meets criteria for an existing mental disorder. And we also have descriptive assessments designed to tell us a little bit more about who our client is and what issues impact that client. When conducting interviews, it's important to ask relevant questions and stay on task. Extraneous questions dilute the focus of the interview and client responses, and also could diminish clients' perception of our ability to help them. Perhaps the most common approach, though, is the use of structured instruments. These are widely popular techniques. They could be administered to individuals or groups and can be used in a variety of settings. They're objective measures, and so they're easier to administer and score than, say, an interview or observation session. There are hundreds, if not thousands, of structured instruments available for your use. Some of the more widely used and popular instruments are the MMPI-2, the CPI, or California Personality Inventory, the Myers-Briggs Type Indicator, and Milan's MCMI-III scale. Let's look for a moment at the MMPI-2. This instrument was designed to diagnose psychological disorders. It was originally developed in the 1940s after years of research by a team of researchers led by Hathaway and McKinley at the University of Minnesota. Since its initial publication, the MMPI and subsequent MMPI-2 has been translated into over 150 languages and has become the most widely used personality assessment in the world. The current version was released in 2001. The instrument contains 567 questions, and it typically takes an hour and a half to 2 hours to complete. Participants are asked to respond to the items using responses of true, false, or cannot say. Scores are then provided on several scales and dimensions, and we'll talk about these. An adolescent version is also available. The adolescent version is slightly shorter, containing only 488 items. Scores on all of the subscales are converted to standardized T-scores. We talked about T-scores when we talked about standardized scores, and it's a way for individuals to all be compared on a common metric. The mean of all of the subscales is 50, and the standard deviation is 10. So if we were to create a bell-shaped normal curve, 50 would be in the middle, and our standard deviation units would go out in intervals of 10 either direction. So we would have 60, 70, 80 above, and then below the mean, 40, 30, 20. There are a couple of ways to interpret the results. T-scores that are 65 and above are considered elevated and may represent psychological distress in a client. These are the items that create the red flags. They identify areas that we would need to work with the client in further detail with. Scores that are 2 standard deviations above or below the mean are considered clinically significant. So with a standard deviation of 10, we're looking at scores that are above 70 or below 30. In terms of interpreting the MMPI, you have several different types of scales. There are validity scales. There are content scales. And there are clinical scales. First, you need to determine the profile's validity. In other words, is it an accurate depiction of the client's personality? Or did the individual, for one reason or another, provide you with a profile that is flawed and biased? Then you want to look at configural scales. A configural scale is a collection of basic scales that, when put together, identify a personality type for this individual. These content scales are comprised of several different basic scales put together in different collections and assortments. Some created by the developers of the MMPI, others came after. Now, when we talked about configural information and looking at code types, we're looking at the basic scales. And a score is derived for each of the basic scales. We will take the highest 2 or 3 scales. Particularly, we want ones that are above 65. Those scales then can be used to come up with a configuration type or a code type. When looking at the code type, the highest scale determines the predominant personality type. However, when scales are within 5 to 7 points of each other, they're interchangeable. For example, if an individual's 2 highest scales are 75 and 71, those are close enough that it would not matter which you listed as the dominant and which you listed as the secondary. However, if it was 74 and 65, there would be a clear dominant personality, and that one would need to be listed first. Most of the time, however, order is not vital because scales fall within a close enough accepted range to be interchangeable. So what scales are we looking at? Well, MMPI-2 provides you with a lot of information. There are validity scales, basic scales, content scales, and supplemental scales. The validity scales assess whether or not the profile is valid and accurate. Did the individual complete enough items? Not omit too many items? Deliberately fake good or deliberately fake bad? Basic scales are the clinical scales. They are used to assess disorders. Content scales look at collections of the basic scales and form personality types. Whether a person is introverted, extroverted, attention-seeking, socially isolated. And then finally, the supplemental scales. These were developed by third parties after the instrument had been developed. But what these supplemental scales do is they take collections of items and use them to come up with screeners for various other types of clinical issues or disorders, such as substance abuse issues, eating disorders. A listing of the scales that appear in the MMPI is available on the Blackboard page for you to view. Notice how many there are and what MMPI-2 can screen for in your clients. In terms of administering the exam, it could be administered paper and pencil or through a computer administration. The paper and pencil administration requires an individual to fill in a bubble sheet with their responses, whereas on the computer, they simply mark their selection. To administer the exam, you need to be a qualified clinician. The qualifications for MMPI-2 Administration are a doctorate in psychology, counseling, or some related field, a minimum of 25 hours of supervised testing experience, a current professional counseling practice license, and the authority to administer tests in your home jurisdiction. Some states have localized laws in terms of testing access and right to use. These laws determine who can and cannot use tests and which particular tests may be available to certain individuals. Clients need to have at least an 8th grade reading level, which is not really that low. The vocabulary and language used on the test necessitates a reading level that high. As I mentioned, it could take anywhere between an hour to 2 hours to complete the exam, and the entire administration must be supervised. Even while the individual is going through the test, you should be supervising and observing their behaviors and response patterns. Should time be an issue, a shorter version can be used. 370 of the original 567 items can be pulled out and used. When using the shorter version, clinicians are not provided with information on those additional supplemental scales. So depending on what your needs are as a clinician, you should determine whether or not the long or the short version is best for you. Despite its popularity, there are some issues with MMPI-2. For one, many of the scales are intercorrelated. They overlap. Symptoms of disorders are similar. Changes in sleep patterns or eating behaviors are common symptoms across disorders. Because they are not discrete and separate entities, there is some overlap. Responses will change over time. Statistically, this is not a good thing as reliability is compromised, but practically speaking, this is a good thing, or can be a good thing. We would expect clients to change, hopefully get better through their experiences in treatment. The length of the examination also is an issue. Depending on your work setting and access to clients, you may not have 1 to 2 hours to devote exclusively to test administration. And finally, test takers may be confused by the items, an artifact of face validity. The items are written in a way that it's very difficult for the average person to discern what it is they're being assessed on by looking at the items. This is one of the benefits of the instrument. Individuals cannot look at items and then alter their response or fake a response to produce a certain result. Another type of personality test is the California Psychological Inventory. This is a variation of the MMPI-2. The difference here is that this instrument was constructed to assess normal individuals. Of course, you should instantly see that one of the challenges we have here is what is defined as normal. Who determines what normal is? It's an artificial construct. With that being said, though, the objective of the CPI is to diagnose and better understand behaviors in the general population. So while the MMPI-2 is really geared more towards a clinical population, CPI is for a normal population. The reading level for the CPI is lower than the MMPI, with only a 5th grade reading level being needed. The instrument is comprised of 434 true-false items, eliminating the cannot say option. And there are 20 different subscales. Those subscales are grouped into 4 different clusters or personality types, which measure an individual's poise and self-assurance, their normative orientation and value systems, their cognitive and intellectual functioning abilities, as well as their role and personal style in interactions with others and managing their environment. Like the MMPI, scores on these scales are standardized, and the T-scores have a mean of 50 and a standard deviation of 10. When it comes to scoring the CPI, we look for subscale scores of 60 or greater. These indicate psychological health. These are areas in which the person is excelling or doing well. Items that are below 40 are indicative of distress. These are areas we may want to focus on in our work with clients, trying to address. I believe it's important to note that there is markers for psychological health. The CPI takes a wellness-focused approach or a strengths-based approach. Identifying what clients do well allows us then to take the skills and abilities they have in those areas and translate them into those areas in which they're experiencing distress. It's based on the interactivity of skills and abilities. These subscales and clusters can be combined to create vectors. We could determine whether an individual is more internal or externally focused, whether they are norm favoring or norm questioning, and also whether they are self-realized or self-actualized. So the instrument provides quite a great deal of information about an individual's personality. Another popular personality assessment inventory is the Myers-Briggs Type Indicator. It's based on Carl Jung's theory of different personality archetypes. Several variations of this instrument exist: the Keirsey Temperament Personality Inventory, and many other popular online versions. The Myers-Briggs is based on the belief that your behavior is determined by how you prefer to perceive your environment. How you perceive the environment determines your reactions. And there are 4 bipolar dimensions created. Your preference for the different polar opposites along these 4 dimensions help to create a psychological type. The 4 dimensions are your preferences in attitudes, whether you are extroverted or introverted. Your preferences in perception, whether you are sensing or intuitive. Your preferences in judgment making. Are you an individual who needs to think things out and plan things out? Or are you more of a feeling person and go on gut instinct? And your preferences in dealing with the outer world, whether you're more judging or perceptive. An individual has a polar strength in each of these 4, and that creates your psychological type. You could be an ESTJ, an INFP, an ENTP, or ISFJ, or many others. There are 16 different types that you can be. There are some issues, though, when using the Myers-Briggs to consider. You want to make sure that you address the validity issues. Accuracy is an issue. Just because the test says this is your preference, that doesn't mean you absolutely are going to act that way all the time. People will take the test and say, that's not exactly me. It's a preference. It's not an absolute. Because we're looking at preferences, there's also some discussion over whether we're really measuring types. Perhaps it's not a trait we're measuring, it's more of a state that we're measuring. It also looks at there being a dichotomy for the 4 dimensions. You're either one or the other. It doesn't speak a lot to the gray area in between. Maybe there are variations. People slide between the 2 extremes depending on situation. If that's the case, then situational factors need to be considered. What's the context or the situation that you find yourself in? So when using it, it's important to remember that it's just a snapshot. It's how people are at that moment. Scores can change quite readily. In fact, if you've taken the instrument multiple times, you probably score differently each time you take it. Another instrument used in personality assessment is the Milan inventory, or the MCMI-III, which is the current version. It's a self-report questionnaire that assesses a wide range of information about a client's personality, emotional adjustment, and attitudes. Unlike some of the other personality assessments, it addresses disorders and the symptoms of these disorders. So it's not only used to diagnose, but it's also used to treatment plan. Whereas other instruments just identify whether or not a person has a disorder, the MCMI talks about the symptoms they experience, as well as the severity or intensity of those symptoms, so that treatment plans can be personalized for the individual. The instrument itself includes 175 true or false items. Those items are then disaggregated into 28 scales. Those scales are divided into following categories. We have modifying indices, which are used to determine the validity or accuracy of the profile. Clinical personality patterns, severe personality pathology, clinical syndromes, and severe syndromes. The clinical scales align with the DSM-4. Now, with the advent of DSM-5 coming out recently, the instrument is sure to be renormed, and potentially a new version will come out. But it matches the diagnostic criteria included in DSM-4. The severe syndromes and personality scales look at the symptoms that an individual has. Those are the components used for treatment planning. To interpret, you want to look at base rate scores. Base rate scores come on an average range of 0 to 115. They're used to determine whether or not a particular characteristic is present in that individual. A base rate score above 85 means that the characteristic is definitely present in the individual. A base rate score above 75 means that the characteristic is partially present in the individual. For comparison's sake, scores around 35 is about average for a non-clinical sample. And scores around 60 are average for a psychiatric population. So as you can see, we're looking at the clearly elevated scores. The process you would go through in interpreting the MCMI-III is first to determine the profile validity. Is it an accurate profile? You then want to look at the personality disorder scales and the clinical syndrome scales. Does an individual meet criteria for a certain disorder? There are then noteworthy responses. These items look at such clinical issues as suicidality or harm to self that you may also want to focus on in your work with the client. You then look at the diagnostic impressions, which talk about the symptoms clients experience. And that's used to build your treatment approach, coming up with an individualized treatment plan for that client. Another instrument which you'll come to see, the 16 personality factors. This instrument measures normal personality, problem-solving abilities, and preferred work areas. It's one that's used less in a clinical setting and more in a counseling setting. It's not designed to assess or diagnose pathology, but it's used to determine strengths and abilities of an individual. Personality types, or the 16 personality factors, can be combined to focus on the big 5 personality factors of anxiety, self-control, extroversion, independence, and tough-mindedness. The factors were identified by Keitel in the 1930s. They were intended to be a classification system to identify how behaviors and expressions of personality can be seen in individuals. At the time, there was a great deal of work being done to identify different personality types. Initial work had over 7,000 different personality types. Subsequent researchers worked to shorten the list, and Keitel's represented one of the most condensed versions at the time. The instrument has 185 items to which respondents provide their response using a Likert scale. Similar to the 16 personality factor is the NEO-PI-R, the Neo Personality Inventory. It's currently used a lot in business settings, workplace settings, looking at teamwork, management, leadership skills, but it also measures the big 5 personality dimensions. Like the other personality inventories, it's about the same in length, 240 items, and it uses a 5-point Likert scale. Other instruments that you may hear or see in reference to personality assessment are the Milan Index, Personality Assessment Inventory, the PAI, the Piers-Harris, which is a children's measure, and the Tennessee Self-Concept Scale. We will not go into depth with these instruments, but they are ones that you may come across. So overall, these structured approaches have some advantages. One, we're able to gain an objective and precise estimate of the aspects of an individual's personality. Subjectivity is removed. It's no longer what we think we see, it's what clients report. There is a great deal of evidence supporting the use of these instruments. They are empirically supported. And they're easy to use. Standardized instructions for how to administer, score, and interpret them take a lot of the subjectivity out. The drawbacks of these inventories is that client deception may be possible. Although validity scales and accuracy scales are included on these instruments, it is still possible for clients, because they are providing the information, to skew the results. There may be a bias for social desirability. Instead of reporting how they actually feel, clients will report how they think you want them to respond. Clients may also use a particular response style, always choosing the first option, having a pattern in their responses. These instruments also have low predictive validity because we cannot define the construct of personality. It's difficult to have an instrument that predicts what your personality will be. The person taking the test must know themselves. They must have some insight into who they are as a person and what some of their preferences and styles are. And finally, there is rarely any time given to assessing the reasons behind statements on the test. Clients are either marking true or false, or agreement or disagreement. But there's no qualitative piece that allows them to follow that up with why they may have answered this way, or what's their rationale or thinking for providing that response. So the structured personality inventories are a vital component of a counselor's practice. They're widely used and have been greatly advanced throughout the years. As you make the decision to use them in your practice, consider the advantages and disadvantages of each, the particular demographics of your client, and the reasons you may need it in session. What are the goals that you have? What is the information you need from the client? And how will this instrument help you reach those goals? Keeping these factors in mind will allow you to make informed decisions on test selection.